Today in the news, Mayor Johnson will accept donations from Aga Khan Council and an SMU quarterback, and Texas moves to test everyone in nursing homes as deaths are on the rise, and the City of Dallas Hospital Capacity Report. Today is May 14th, 2020, and this is Dallas Weekly News. Hello, I'm your host, Patrick Washington, and this is Dallas Weekly News. Mayor Eric Johnson will visit Dallas Fire Rescue Station 4 to receive 2 donations intended to help the city respond to the COVID-19 pandemic. The Aga Khan Council for Central United States, a social governance body of the Ismaili Muslim community, will donate 10,000 surgical masks, 10,000 pairs of gloves, and 1,000 bottles of hand sanitizer to the city of Dallas. Those donations will be distributed to the city of Dallas first responders and frontline workers. Members of Dallas Fire Rescue and Dallas Police Department will be on site to accept the donation with the mayor. Mayor Johnson, on behalf of the Mayor's Disaster Relief Fund, will accept a $50,000 check from SMU quarterback Shane Buechele and Paige Vasquez, a corporate communications and events coordinator for the Dallas Mavericks. Buechele and Vasquez said that they decided to raise the money to give back to their community. For more information on COVID-19 from the city, you can visit dallascityhall.com/coronavirus. On Monday, Governor Greg Abbott ordered coronavirus testing for all Texas nursing home residents and staff after the White House urged the nation's governors to do so as deaths mount nationwide. The directive by Abbott to state health officials came hours after Vice President Mike Pence, who leads the White House Coronavirus Task Force, told governors on a video conference call that it was the federal government's strong recommendation to test all nursing home residents in the U.S. in the next 2 weeks. It also came as San Antonio officials announced the first death of an employee at a nursing home that back in April was struck by one of Texas's first major outbreaks. More than 100 people tested positive for the virus at Southeast Nursing and Rehabilitation Center, and 18 residents have died. Laura Myers, a spokeswoman for the city, said the employee was a woman in her 60s with underlying medical conditions. More than 26,000 residents and staff have died from outbreaks of the virus at the nation's nursing homes and long-term care facilities, according to an Associated Press tally based on state health departments and media reports. That is about a third of the 76,000 deaths in the U.S. that have been attributed to the virus. Texas has had more than 39,000 cases and at least 1,100 deaths related to the virus. State health officials Monday announced there have been an additional 10,000 cases and 12 new deaths. The true numbers are likely higher because many people have not been tested, and studies suggest people can be infected and not feel sick. Governor Greg Abbott has said he's focused on hospitalization rates that remain steady and infection rates that have dropped since mid-April. Barbershops and hair salons were allowed to start reopening in Texas on Friday. Last week, restaurants and retailers in the state were allowed to begin reopening with limited capacity. For most people, the coronavirus causes mild or moderate symptoms such as fever and cough that clear up in 2 to 3 weeks. For others, especially older adults and some people with existing health problems, it can cause more severe illnesses, including pneumonia. And now, the City of Dallas Hospital Capacity Report. Thank you for joining us. This has been Dallas Weekly News. I am your host, Patrick Washington. You can catch these and more stories at dallasweekly.com and follow us on social media on Facebook, Twitter, Instagram, and YouTube. And as always, stay home, stay safe, and we will see you tomorrow.